Welcome to the Healthcare Personnel Safety Component training session. Today, we'll review the influenza vaccination summary of the Healthcare Personnel Vaccination module. My name is Elizabeth Kalayil, and I work in the NHSN Vaccination Unit. I will be presenting information during this webinar today, along with my colleague, Jolie Siegel. This presentation will cover several topics. The steps on how to get started in the healthcare personnel safety component will then be reviewed, along with the surveillance and reporting requirements for the module and the data reporting forms facilities will need to use. The last segment of the presentation will outline the data analysis features of the application. For the 2023-24 influenza season, facilities that are part of certain CMS reporting programs will need to report annual healthcare personnel influenza vaccination summary data. The data are reported through the healthcare personnel safety component in NHSN. On the NHSN left-hand navigation panel, find Facility, and then select Add Edit Component. Please note that facilities must activate the healthcare personnel safety component in NHSN to report annual influenza vaccination data. Only the NHSN facility administrator can activate a new component. Before a new component can be added, users and facility administrators must upgrade to level 3 if this has not already been completed. We'll review the steps for this upgrade later in the presentation. The reporting period for the 2023-24 influenza season is from October 1st, 2023 through March 31st of 2024. For facilities that are required to report the data by CMS, they will need to submit one report covering the entire influenza season. So in other words, weekly or monthly reporting is not required. The deadline to report annual healthcare personnel influenza vaccination summary data through the NHSN Healthcare Personnel Safety Component is May 15th of 2024. NHSN will then transmit the data to CMS. We'll also reinforce these points as we go through the presentation, and we'll review the data facilities will need to collect, how to enter the data, and how to run data analysis reports. The next slides provide an overview of how to get started in the healthcare personnel vaccination module of the healthcare personnel safety component. This slide demonstrates how to see if your facility has already activated the healthcare personnel safety component, a necessary step before you can report influenza data. To check on this, navigate to Facility and Add Edit Component to see if the box next to the healthcare personnel safety component is checked, as shown next to number 1 on the screenshot. If it is, then the component has already been activated. If the facility administrator has also accepted the agreement to participate and consent, as shown in number 2 here, you are ready to report your data. And make sure not to deactivate the healthcare or the long-term care component. If you do need to activate the healthcare personnel safety component, facility administrators will log into the long-term care component or the healthcare personnel safety component if a non-long-term care facility, and navigate to Facility and then Add Edit Component. Facility administrators will then scroll to the components followed and then check the box next to healthcare personnel safety. An alert will pop up indicating that you must first define the primary contact for the component, and then click OK. Enter the contact information on the next page for your healthcare personal safety component primary contact. Note that this can be an existing NHSN user. After submitting and updating the information, your facility administrator must return to the NHSN homepage and log in to the healthcare personnel safety component to accept the agreement to participate and consent. Once rights are accepted, your facility is ready to submit data for the healthcare personnel safety component, including annual influenza vaccination data. Now we'll review the specific reporting requirements for healthcare personnel influenza vaccination data. There are 3 required healthcare personnel categories. One category consists of employees, while the other 2 categories consist of non-employees. One non-employee category is licensed independent practitioners, and the other non-employee category includes adult students, trainees, and volunteers. To be included, all healthcare personnel must be physically present in the facility for at least one working day during the reporting period, which is between October 1st through March 31st. This slide shows the top portion of the data collection form, which lists the healthcare personnel categories. Employees are defined as all persons receiving a direct paycheck from the healthcare facility, regardless of clinical responsibility or patient contact. The second healthcare personnel category consists of non-employee licensed independent practitioners, specifically physicians, advanced practice nurses, and physician assistants who are affiliated with the facility but are not on the facility's payroll, and that's again regardless of clinical responsibility or patient contact. This category also includes post-residency fellows. The third required healthcare personnel category consists of non-employee adult students, trainees, and volunteers who are aged 18 and older. This is defined as medical, nursing, or other health professional students, interns, medical residents, or volunteers aged 18 or older that are affiliated with the healthcare facility but are not on the payroll, regardless of clinical responsibility or patient contact. This category consists of non-employee contract personnel. Reporting for the category is optional at this time. Contract personnel are defined as persons providing care, treatment, or services at the facility through a contract and who do not fall into any of the other denominator categories. Some examples include dialysis technicians, occupational therapists, admitting staff, and pharmacists. Please refer to Appendix A of the Healthcare Personnel Vaccination Summary Protocol for a suggested list of contract personnel. If a facility decides to report contractor data, it can note for which categories of personnel are included in their data by using the comments function in NHSN, which is noted later in the presentation. Vendors are also included in the other contract personnel category, regardless of clinical responsibility or patient contact. Therefore, vendors providing care, treatment, or services should be included in the category if they physically work in the facility for at least one day during the reporting period. There are 5 healthcare personnel categories in the NHSN module, and these are mutually exclusive. This slide highlights the healthcare personnel categories as they appear on the form. The categories include influenza vaccinations received at the facility or elsewhere, medical contraindications, declinations, and unknown vaccination status. Question number 2 on the influenza vaccination summary form covers healthcare personnel who received influenza vaccination either at the healthcare facility or elsewhere. Please note that there are 2 separate fields in the NHSN module. The first field includes healthcare personnel who received vaccination at the facility since vaccine became available this season. Question number 3 includes healthcare personnel who are vaccinated outside the facility since vaccine became available and provided a written report or documentation of vaccination. Acceptable forms of documentation include a signed statement or form, an electronic form or email from the healthcare worker, or a note, receipt, or vaccination card from the outside vaccinating entity. Verbal statements are not acceptable for the module. Question 4 includes healthcare personnel who have a medical contraindication to the influenza vaccine. For the measure for inactivated influenza vaccine, accepted contraindications include a severe allergic reaction after a previous vaccine dose or component, including egg protein, or a history of GBS within 6 weeks after a previous influenza vaccination. Healthcare personnel who have a medical contraindication to live attenuated influenza vaccine, other than a severe allergic reaction to a vaccine component or history of GBS within 6 weeks after a previous vaccination, should be offered IIV by their facility if that's available. Therefore, the medical contraindications stated above are the only acceptable contraindications for this module. The 5th category is healthcare personnel who were offered and declined to receive influenza vaccine. Documentation is not required for reporting declinations. And the 6th category is healthcare personnel with unknown vaccination status, or they did not meet any of the criteria for the other numerator categories. So now we'll review data entry. I will turn things over to my colleague, Jolie Siegel.
We will now go over entering data for the HCP influenza vaccination summary. First, we will go over how to navigate through NHSN. You can access the activity homepage by clicking on the link listed on the slide. You will then need to enter your SAMS username and password, followed by your SAMS grid card numbers. If you have questions or need assistance with using SAMS, please contact the SAMS Help Desk toll-free by phone or by email using the information listed here. Once you are on the NHSN landing page, facilities will need to select the healthcare personnel safety component in the drop-down box. This slide shows the HPS component homepage. You will see that there is a navigation bar on the left-hand side of the web page, which can be used to access different parts of the module. This slide shows the steps facilities take to access the HCP Influenza Vaccination Summary form. First, click on the Vaccination Summary, then Annual Vaccination Flu Summary on your navigation bar. Select Add. Next, click Continue to view the data collection form. Facilities with mapped IRF units will see this screen when adding HCP influenza vaccination data. The user must complete all fields marked with an asterisk on this page. Influenza and seasonal are the default choices for vaccination type and influenza subtype. The user would then select the appropriate flu season in the drop-down box. For example, if you are reporting data for the 2023-2024 influenza season, you must select 2023-2024 in the drop-down box. This is very important since data submitted under the incorrect influenza season will not be shared with CMS and will not fulfill their reporting requirements. Facilities can always contact NHSN if they are unsure of which influenza season is currently being reported. The user should select the appropriate location from the drop-down box. For example, to report data for the long-term acute care hospital, you would select hospital. To report data for an inpatient rehabilitation unit that is part of your hospital, you would select IRF unit. Please note that to report data for both hospital units and IRF, a summary report should be submitted for each. Facilities without an IRF or IPF will see their screen when they go to report data. The drop-down for locations will be missing, but otherwise it is the same screen. This slide shows what the data entry screen looks like in the NHSN module. The asterisks on the screen indicate the columns that must be completed. Users can use the Tab key on a computer keyboard to move across columns. Users should enter 0 in a field if no HCP at the facility fall into that category. The comments box can be used to enter additional information, which are usually side notes or reminders. However, the information cannot be analyzed within NHSN. Once the data has been entered, click the gray Save button to save the record. Please note that the summary record must be entered into NHSN prior to the May 15th reporting deadline in order to have your data shared with CMS. Any data that are entered after the May 15th reporting deadline will not meet the submission requirements for the CMS Quality Reporting Program. If you would like to edit or update your facility data, simply click the Edit button at the bottom of the screen for modifying existing data. Once you have completed your edits, please be sure to save the updated data by clicking the Save button that will appear at the bottom of the screen. Please be aware that resubmission of data after the initial entry will overwrite past data submission. The date last modified shows when data were last entered and saved. Facilities can also add data via CSV upload. They can do this by following the same pathway as described previously and then clicking on Upload CSV. CSV templates, files, and instructions can be found on our webpage. Look under the CSV Data Import heading and under the Annual Healthcare Personnel Flu Vaccination Data subheading on the webpage. We will now go over the data analysis features for the HCP Influenza Vaccination Summary. To view data, go to the Generate Datasets under Analysis on the navigation bar. Click Generate New and select OK when a message appears on your screen that says, "The current datasets will be overwritten. Are you sure you want to continue?" Users should generate a new dataset after each time they entered new data into the system. Next, go to Output Options under Analysis on the navigation bar. You will see several folders on the screen. IRFs that are enrolled separately or freestanding IRFs should click on the HCW vaccination module and influenza. To view the default output, click Run Report to see total numbers or summary counts, percentages, vaccination compliance figures, and vaccination non-compliance figures. IRF units within acute care facilities should click on the HCW vaccination module, influenza, and IRF influenza. Those units will need to click on an extra folder to view their data. Clicking on Run Report will display the default output. For IPFs that are enrolled separately or freestanding IPFs, click on the HCW vaccination module and influenza. To view the default output, click Run Report to see total numbers or summary counts, percentages, vaccination compliance figures, and vaccination non-compliance figures. IPF units within acute care/critical access hospitals should click on the HCW vaccination module, influenza, and then IPF influenza. These units will need to click on an extra folder to view their data. Clicking on Run Report will display the default output. For users wishing to modify the default analysis output, they can click Modify next to the report they wish to modify. The Modify function can be used for several things. The user can export the dataset into various analysis software such as Excel and SAS, change the title of the modified output for later use, and change the format of the output so that it can be viewed in a PDF or HTML format. A facility also has the option to view output using variable labels. An example is shown on the slide of how it looks to view the output using variable labels instead of viewing this by variable names, which are used when running the output. We will now go over how to confirm data entry. After the data have been entered into NHSN, users can verify that data have been saved correctly by running a report within the NHSN analysis feature. This report can be found by facility type in a subfolder of the CMS reports folder. By running this report, the facility can review the HCP influenza vaccination data by influenza season stratified by HCP category: employees, licensed independent practitioners, adult student trainees and volunteers, and all three categories combined. This report shows the exact information that will be submitted to CMS for your facility. Remember that by default, the results will appear in a separate HTML window. If a second window does not appear when you click the Run button, please be sure to check your pop-up blocker and allow pop-ups from .cdc.gov. Please refer to the link on this slide for the step-by-step guidance for running and interpreting this report for each facility type. In addition to running the CMS line listing described on the previous slides, facilities can confirm two other pieces of information within NHSN to ensure their data will be shared with CMS appropriately. Both of these pieces of information can be confirmed on the facility information screen within NHSN. To get to the facility information screen, click on Facility, then Facility Info on the left-hand navigation bar. First, verify that the correct facility CMS certification number and CCN effective date have been entered effectively. Your CCN effective date should be the date your facility first received its CCN from CMS. If you cannot obtain that date, but it was prior to January 1st, 2017, please use January 1st, 2017 as the CCN effective date. You also need to ensure that your facility is enrolled in NHSN as the correct facility type. If your facility is not correctly enrolled, please contact nhsn@cdc.gov for assistance. This is very important as only data from facilities enrolled as the correct facility type will be shared with CMS. As long as your data appear in the CMS line listing for the current reporting period, your CCN and CCN effective date are correct, and your facility is enrolled correctly, no further action is required on your part, and your data will be shared with CMS following the reporting deadline. Please note that NHSN does not provide a confirmation email to facilities once they have submitted their data. The next few slides will outline some resources that may be helpful to you. The NHSN website contains links to the data collection forms, tables of instructions for reporting data, and training slides that facilities can use when reporting HCP influenza vaccination summary data through NHSN. Please refer to materials under the Annual Flu Summary heading on the webpage. If you have any questions about NHSN, please send a ticket to NHSN Service Now. The new portal can be accessed at the link above. If you do not have access to SAMS, you can still email the NHSN help desk at nhsn@cdc.gov. Thank you so much for your time. We wish you all a wonderful day.